Hi, my name is Brian Green. I am currently an associate professor of dermatology at Hershey Medical Center. I finished my residency in dermatology at Carolina back in 2009 and then did a fellowship in pediatric dermatology up at University of Pittsburgh at Children's Hospital. For those of you coming in, my advice, pace yourself. It's a 3-year residency for a reason. You will learn a lot and you do not have to learn it all in 1 year. I found myself, after 8 years serving in the military, practicing in some very strange places: Mazar-i Sharif, Afghanistan, Pabradė, Lithuania, in southeast Lithuania. Didn't matter where I went, I knew I had what I needed and I could get the job done because of my time there. So go Tar Heels.
Hi, my name is Ruchi Bhandari and I am an alumni from UNC Dermatology. Currently, I'm working at Bukai Center for Dermatology and Aesthetics, and it's been my 5th year right out of residency. I am always very proud to say that I've graduated from the University of North Carolina Dermatology Residency Program. It has been a fantastic experience working with all of my mentors there. I still hear them telling me what I should be telling my patients when I see certain conditions. We've all established lifelong friendships. I still have a group of my friends from my class that we always text interesting cases to. I think you'll have a fabulous experience at UNC. I really miss being with them, but now in San Antonio, we've at least been able to connect via Zoom, and I still have really great relationships with my previous faculty and residents. I hope you really consider UNC Derm because it's a great program. Thank you.
Hi guys, my name is Shatila Meen. I'm an assistant professor of dermatology at Northwestern University in Chicago, Illinois. I am actually a graduate of the UNC Dermatology Residency Program. I graduated in 2012 and I have been in Chicago in this role here at Northwestern ever since then. I wanted to reflect back and kind of just tell you guys about my thoughts about the UNC residency program. Looking back and being at 2 different residency programs, I can definitely say I had such a superb education at UNC, one that I value more and more the more years I've been in practice. I can say, as a medical student, as you guys are exploring programs, one of the positive aspects of the UNC dermatology program is you have such a nice blend now of experienced faculty that have been doing this for many years, and also junior, younger faculty that have a fresh new perspective to add to the residency program. You have many areas of niche expertise, both within general dermatology and the other subspecialties like pediatrics and Mohs. Within general dermatology, you have Dr. Thomas, who's an expert in melanoma, Dr. Jolly, who's an expert in high-risk skin cancer in the immunocompromised patients, Dr. Syed, who has really made a name for himself in hidradenitis suppurativa, Dr. Lugo in patch testing, Dr. Colton in autoimmune blistering diseases, and obviously many other names that I can't mention. In pediatric dermatology, I mean, you will just get an absolutely world-class education in pediatric dermatology led by Dr. Dean Morell. It's such a rich pediatric dermatology experience at UNC. And one of the other things that I would ask you guys to look for, right, is look for role models when you're interviewing at these programs. Try to envision who your role models could be. And I can say that one of the things that I got out of UNC was just really fantastic role models that really taught me about the dedication that you need to have as a physician to patients, the sincerity being a good physician, and the honesty that's involved. I still think about my days as a resident when I was at UNC, and I think about being in the room with Dr. Dean Morell and just learning about how to make patients comfortable, how to make patients and their families comfortable with conversation. And it's something that I use in my practice to this day. I wish you guys the best in your virtual interviews. It's going to be a different experience for everyone, but I really encourage you guys to try to look at these programs and try to look for the programs that are going to provide you those role models. The program that's really not only going to teach you the art and craft of being a good dermatologist, but the program that's really going to provide you the role models to help give you a foundation of how to be a good physician.